I want to tell you why I'm not frightened. It's not because I don't understand how serious coronavirus is. It's a global pandemic, and the possible death toll, if we don't get it right with our isolation and social distancing and all the other measures, the potential death toll is absolutely staggering. So it's not that I don't understand, because I absolutely do. It's because it's beyond my control. If you only know me from this channel, from Left Eye View, you won't have seen my other stuff on stoicism. You see, I'm a practising stoic, and I want to use a little bit of stoicism now to show you why I'm not afraid, and also why, if you can master these techniques, and admittedly I've been doing it a few years, if you can master these techniques, you don't need to be afraid either. The first thing to bear in mind is that there are things we can control and things we can't. The things that we can control are very limited. They're our thoughts, our feelings, our behaviours, and to a limited extent, our bodies. And certainly in this case, that's very limited. If you catch coronavirus, you won't really be in control. But we can control our thoughts and our feelings and our behaviours. So Epictetus says concentrate upon those. Well, okay, what can you do? Well, you can follow the instructions of the government for a start, so don't go out unless you need to. When you do need to, go out for a short time, maintain social distancing, wash your hands. But really that's it, that's all you can control, isn't it? What you do, what you think, and to an extent, if you've learned the techniques, what you feel. Now, think about anxiety. Anxiety is an emotional prompt. It's a call to action, if you will. It's the feeling you get when you jump out of the way of the speeding car coming round the corner. Before you've even had time to think, anxiety has got you to move to safety. And if you use your anxiety as the tool that it is to benefit you, that's great. So use it. It's a call to action, so take action. Follow the rules. And once you've followed the rules, understand that the rest, what happens with the virus, whether or not the epidemiologists have got it right, whether the government's giving the right advice, they're out of your control. And there is no point in being anxious about what you cannot control. There's no benefit to that. There's no call to action, because there's nothing for you to do. So focus on the things you can do and don't worry about the things you can't. Now, I know that will sound really, really simple, too simple to an awful lot of people who hear this message. But I promise you, if you practice this separation of what you can control and what you can't control, then make a plan to do the things that you can do, it's much easier to put anxiety away once it's served its purpose. That's why I'm not frightened. Not because I don't understand. I am well aware that I will almost certainly contract coronavirus at some point. My task is to do all that I can to delay getting coronavirus within the context of going to work for the health service and therefore meeting people who are ill, and because of my role in mental health, I will be meeting people who don't necessarily understand and don't necessarily take this as seriously as maybe they should, so their hand washing might not be entirely up to scratch. Hence, by the way, the appeal for hand sanitizer. But within that context, my plan is to delay my onset of coronavirus for as long as I can, because that will allow the NHS to treat people in a staggered way. We won't all get ill at the same time if we all do the best we can to avoid contracting the disease. That means we probably won't overwhelm the system. Bear in mind, we only have about 1,000 ICU beds in this country. That's not enough if we all get ill at once. So that's what I'm doing. I'm doing all that I can to put off the inevitable. But given that it's inevitable, I'm not scared of it. Why be frightened about what you can't change?